You're welcome to my channel. Today I'll be addressing brain death. But if you haven't listened to the following, please kindly do. I have them published right here. Locked-in syndrome, Lazarus syndrome, vegetative state, and confirmatory test for brain death, which is apnea test, all published right here. Brain death is an irreversible loss of cerebral and brainstem functions. All other organs are no longer coordinated. Each other organ will be viable as long as the life support remains in place. Some equate brain death to life death, maybe religious belief or whatever the case might be. There's brain death, which is also known as biological death, and also there's clinical death or somatic death. The importance here is for the purpose of organ donation and to be able to discuss with the family members or the source decision maker as per organ donation. It is helpful to know once brain death has occurred so that you can make that determination. There is no fixed criteria for steps within to and after someone has become brain dead. Protocols vary based on the head authorities, the hospitals, the jurisdictions, states, provinces, and even countries. In other words, even this presentation is not so rigid that is what you're going to find if you get to that hospital. So somebody is listening to this in India, another one in the UK, another one in Brazil, another one in Kenya or Indonesia. There's nothing fixed. Some tagged brain death to be failed CPR. What are the probable causes of brain death? Trauma, subarachnoid hemorrhage, intracranial hemorrhage, hypoxic ischemic encephalopathy, stroke, metabolic derangement, and all causes of encephalopathy. Diabetes mellitus, concussion or contusion, thyroid disorders, toxins, acute traumatic brain injury, non-traumatic neurodegenerative disorder, metabolic disorder, congenital abnormality of the central nervous system, infection like meningitis or encephalitis. How do you make diagnosis of brain death? Number one thing, full history, thorough history, prior diagnosis. And we have to rule out all reversible causes that could mimic brain death. Toxicological screening, particularly to screen for both prescription and street drugs. Temperature is very, very important. Be sure that there is no hypothermia. Is there a metabolic derangement? Like what? Electrolyte imbalance, diabetes mellitus, might be hypoglycemia or hyperglycemia, severe hypothyroidism, circulatory collapse like hypotension, acid-base disturbances or overwhelming sepsis. These are probable reversible conditions that we must rule out before we run into the conclusion that this person is actually brain dead. Then we have full neurological examination. Is this patient in coma? Let's be sure that that's not the case. Full central nervous system examination, motor sensory or reflexes, Babinski sign, everything must be done. Still on diagnosis, let's get the lab reports before us. On the thyroid function test, electrolytes, complete blood count, glucose, Let's have it. Have they reported the toxicological screening? Have lactate in the blood and CSF? Acid phosphatase, glutathione, creatine kinase, neuron-specific anoles. Let's get all those out. And are we, equipped with the radiological report as well? CT angiography, magnetic resonance angiography, EEG, and of course EKG. What's happening to the heart? Arrhythmia, transcranial Doppler, SPECT, brainstem auditory evoked potential, atropine test. Let's remember the differential diagnosis here. Are we dealing with cardiac arrest or hypothermia? Is this locking syndrome? Check my channel for that. Is this metabolic encephalopathy, polyneuropathies, or drug intoxication? Is this individual actually dead? Brain dead and somatic dead. Who will write the conclusion? It depends on the local protocol, please. Mostly, anywhere you are on the surface of the earth, it could be neurologist, 2 physicians. Sometimes 1 physician and a nurse. Even in some jurisdictions, nurses are permitted to make that determination. Nothing is fixed. Nothing is rigid. As per who can declare the status of the patient that he or she is brain dead. Nothing is fixed. Depends on your jurisdiction. Please find out. As far as brain dead diagnosis is concerned, the confirmatory test remains apnea test. Good enough. I have a full presentation on apnea test, the requirements, the procedure, the precautions to be taken, when to stop, and how do you then make the determination that, okay, this is apnea test positive, all right here. Check my channel for that. What is next? Then, when it has been confirmed that this is brain death, the job becomes family support, call family members, substitute decision maker, encourage the family members. This is a difficult time for them. We're all humans, and we will die one day. It's painful. We need to encourage them. You can get your psychologists, social workers, let them come around. Organ donation should be discussed. That may satisfy some family members because they will have the impression that their loved ones are still living inside somebody else in one form or the other. Some family members will decline. Once there's an agreement, begin the process of organ harvesting with the right team. Life support will be on as long as the hospital and the family will agree that it should be on. There are a lot of controversies over when to stop life support after the physicians would have made determination that this is brain death. So, follow the law of the land. Follow the protocol where you're working. Controversies, like I said, brain death diagnosis is controversial. Why? Religious beliefs. Many don't just want to believe. I'm talking about family members right now, loved ones. How can a wife just agree like that the husband is gone? Or the husband just take it just like that the wife is gone? Or parents to children, children to parents. Even close friends. Acquaintances, no, distant relatives is difficult. So family can start having denial. Never. She's not dead. No, that's not what, he told me, she told me, and so on. So no fixed criterion or criteria. The law of the land determines, and that ends the story there. Okay, prognosis or expectations. You ask me, what is it talking about? Oh, you're right. What am I talking about? Somebody is brain dead already. There'll be cardiopulmonary failure, complete cardiopulmonary shutdown. And within few days, brain death will be followed by somatic death, and that is the end of the road. And with that, I can draw the curtain to say this is the end of this representation, from Lazarus syndrome to vegetative state to Logging syndrome to apnea test. Patient is brain dead, and that is brain death. Well, painful for the families. I feel their pains, their loss, but death is inevitable. All of us, doctors, nurses, everybody will still die one day. Thanks for listening. Remember to share. Remember to subscribe. I appreciate it. And my hand goes out to all families who have experienced this and those who will still experience it. Thank you.